Hello and welcome, everyone. Today we are talking about sleep problems in perimenopause. This is an issue that comes up quite frequently, so I thought it'd be appropriate to do an entire little presentation and turn this into a podcast because it is so prevalent among perimenopause and menopausal women. It's one of the many symptoms that we use to actually diagnose perimenopause. So let's get into it. We're going to talk about the top causes of sleep problems in perimenopause and menopause and what you can do about it. As women transition through perimenopause and into menopause, one of the most common and frustrating symptoms that they encounter is a change in their sleep patterns. These changes can range from difficulty falling asleep to frequent awakenings during the night, and even more severe, like sleep disorders and insomnia. Sleep is essential for overall health and well-being, and disruptions can have significant physical, emotional, and cognitive effects. For perimenopausal and menopausal women, poor sleep can exacerbate other symptoms like mood swings, hot flashes, and fatigue, making it even more challenging to navigate this life stage. Addressing sleep issues is not just about improving rest, but it's also about enhancing quality of life. My name is Dr. Nicole Smith. I am the founder of Antigravity Wellness, and I specialize in the care of perimenopause and menopausal women. I am quite passionate about this. It is an area of great need in our healthcare that we're falling through the cracks. And I'm one of them. I had my own struggle and I'm continuing to go through this phase. It can last anywhere from 2 to 10 years going through perimenopause. But I started noticing symptoms when I was 37. I started having some issues with my periods. I was having worse PMS that was really dragging out. It usually was just like a couple days before my period. I wouldn't feel so great. All of a sudden, it was 9 days out. So most of the month, I was miserable. And I knew something was wrong 3 months in. And I'm like, this isn't getting any better. And I tried to go to my primary care. I tried to go to the OB, and neither one of them was very helpful. They drew the basic labs and were like, well, everything looks fine. So you're probably just stressed. You just need to calm down and get more sleep. Not helpful. So I went to a naturopathic doctor. We did a deeper dive, looked at a full panel of my labs, including like my thyroid hormones, and found that I actually was a little low on my thyroid. My progesterone was getting low. Things were happening. And this was in that time frame of perimenopause. You can be in this time frame anywhere after the age of 35, sometimes even younger. And unfortunately, it's getting younger and younger because in our modern society, we are under so much more stress. Our body's under so much more stress in ways that it wasn't adapted to handle. We are adapted to handle acute stressors, like being chased by a lion, but not adapted to chronic stressors, not adapted to a poor diet that's overly processed. And all of this other things that, all the stress that has been uncoupled from movement. So when you do movement, it helps to relieve that stress. So we're going to talk about how all of these things contribute to the symptoms of perimenopause, including sleep disturbances. And then sleep disturbances contribute more to perimenopause symptoms and menopause symptoms. And it just becomes this downward spiral. The best thing you can do is get on top of this right now. Don't wait. The longer you wait, the worse it gets, and the harder it gets to get on top of things. And this is going to affect you for the rest of your life. Even if you're not having significant perimenopause or menopausal symptoms, if you do not address things that are kind of brewing under the surface now in this stage, in your late 30s, 40s through your 50s, you're setting yourself up for worse health down the road. And these are supposed to be your golden years. But guess what? Your golden years start 30 years before. So the time is now to start taking care of yourself. Let's start with our case study. This is Jane. Jane is based on a true story. I don't use exact client information in these case stories to protect their privacy. Jane is a 48-year-old woman navigating the challenges of perimenopause. She began experiencing significant changes in her sleep patterns about a year ago. She noticed that she was waking up multiple times during the night, often drenched in sweat from night sweats and struggling to fall back asleep. This led to her feeling exhausted and irritable during the day. The lack of quality sleep began to take a toll on Jane's daily life. She found it increasingly difficult to concentrate at work, and her mood was more irritable, and she lacked the energy to engage in activities she once enjoyed. Jane also started to experience heightened anxiety, particularly around bedtime, worried that she wouldn't be able to sleep. This anxiety further exacerbated her sleep issues, creating a vicious cycle. Can anyone out there relate to this story or know someone who can? It's very common. Let's talk about some key terms just so that we're on the same page about what these terms mean. If you want a deeper dive on perimenopause and menopause, the different hormones that go into that and all the changes that you can see there, I've done previous episodes on that, so you can just go back through our previous episodes and listen to those if you want to know more about that. I definitely recommend that. So perimenopause is the transitional period leading up to menopause, typically starting in a woman's 40s, but sometimes earlier, like 35. Or in my case, 37. During this time, the ovaries gradually produce less estrogen, leading to irregular menstrual cycles and various symptoms, including sleep disturbances. I wish it was just gradual, by the way. Estrogen usually can go up, and then it can go down, and then it can come up again and go down. There's a bit of a roller coaster ride there. Perimenopause can last anywhere from a few months to several years. Key symptoms include irregular periods, hot flashes, mood swings, and sleep disturbances like insomnia and night sweats. Menopause is officially diagnosed after a woman has gone 12 consecutive months without a menstrual period. This marks the end of her reproductive years, usually occurring around age 51, 52, 53 is usually the average. Hormone levels, particularly estrogen and progesterone, drop significantly during this stage. Testosterone also declines. Key symptoms include hot flashes, vaginal dryness, mood changes, and sleep issues, among many others. So sleep disturbances, insomnia, difficulty falling or staying asleep, which can be acute, short-term, or chronic, long-term, as in more than 3 months. In perimenopause and menopause, insomnia is often triggered by hormonal fluctuations. Night sweats, episodes of intense sweating during sleep, often associated with hot flashes that can cause significant sleep disruptions. Other sleep issues, these may include restless leg syndrome, sleep apnea, or frequent awakenings during the night. So there's some normal sleep changes versus hormonal sleep changes. Normal sleep changes, as a woman ages, it's common to experience some changes in sleep patterns, such as waking up earlier or experiencing lighter sleep. These changes are a normal part of aging. Hormonal sleep changes in perimenopause and menopause, sleep disturbances are often more severe and directly linked to hormonal changes. The drop in estrogen and progesterone can lead to increased frequency and intensity of insomnia, night sweats, and other sleep issues, significantly impacting overall health and well-being. Understanding these key terms helps clarify the connection between hormonal changes and sleep disturbances during perimenopause and menopause. Recognizing the difference between normal aging-related sleep changes and those driven by hormonal shifts is crucial in addressing the root cause and finding effective treatment strategies. The evolution of sleep research in perimenopause and menopause. Early research on sleep and menopause. In the 1950s to 1970s, initial studies on menopause focused primarily on reproductive health, with little attention paid to sleep disturbances. Sleep issues were often dismissed as a natural part of aging rather than a symptom related to hormone changes. In the 1980s, the first formal studies began to explore the connection between menopause and sleep disturbances. Researchers started to recognize that many women experience significant sleep issues during perimenopause and menopause, often linked to night sweats and hot flashes. Growing awareness in the 1990s. Research in the 1990s brought great awareness of the hormonal changes in menopause and their impact on sleep. Studies identified the role of declining estrogen and progesterone levels in disrupting sleep patterns. leading to conditions such as insomnia. This period also saw the recognition of specific sleep disorders in menopausal women, including sleep apnea and restless leg syndrome, further expanding the understanding of how menopause affects sleep. Advancements in the 2000s. Research began to shift towards understanding the broader impact of sleep disturbances on quality of life for menopausal women. Studies highlighted the link between poor sleep and increased risk of mood disorders, cardiovascular disease, and cognitive decline in this population. The 2000s also marked a move towards more personalized approaches to treatment, considering the individual symptoms and health status of each woman. This was a departure from the one-size-fits-all treatments that were previously common, and honestly still are today. Current understanding. Today, sleep research in perimenopause and menopause is more comprehensive, incorporating hormonal, psychological, and lifestyle factors. The role of stress, diet, and exercise in managing sleep disturbances is now well recognized, and there's a greater emphasis on holistic and integrative treatment approaches. Ongoing research is exploring new therapies, including advancements in hormone replacement therapy, HRT, non-hormonal treatments, and alternative medicine to better address the unique sleep challenges faced by women during these stages. The understanding of sleep disturbances in perimenopause and menopause has evolved significantly over the decades. From being largely ignored to becoming a critical area of research, this progression has led to more effective and individualized treatment options for women today. The continued focus on research ensures that future treatments will be even more tailored and effective in helping women navigate this challenging phase of life. How common are sleep disturbances during perimenopause and menopause? Well, research shows that approximately 40 to 60% of women experience sleep disturbances during perimenopause and menopause. Significant. These disturbances can include difficulty falling asleep, waking up frequently during the night, and waking up too early. The prevalence of insomnia in particular is significantly higher in women going through these life stages compared to women who are not yet in perimenopause. There's some differences between perimenopause and menopause. During perimenopause, sleep disturbances are reported by 38 to 46% of women. These disturbances often correlate with the onset of irregular menstrual cycles, fluctuating hormone levels, and the beginning of symptoms like hot flashes and night sweats. Many women in perimenopause also report experiencing increased anxiety, which can further exacerbate sleep problems. In menopause, the prevalence of sleep disturbances increases, with studies indicating that 50 to 60% of postmenopausal women experience significant sleep issues. The transition into menopause often brings more consistent and severe symptoms due to the dramatic drop in estrogen levels, leading to more persistent issues like insomnia and frequent awakenings. Around 75 to 85% of women report hot flashes, which often contribute to night sweats and sleep disturbances. These symptoms tend to be more severe during the late perimenopause and early postmenopausal stages. Postmenopausal women are at higher risk of developing sleep apnea compared to premenopausal women, partly due to hormonal changes and changes in body weight distribution. The prevalence of sleep disturbances during perimenopause and menopause is high, affecting nearly half of all women during these stages. Understanding the differences in how these disturbances present during perimenopause versus menopause is crucial for effective management and treatment. The widespread nature of these issues underscores the importance of addressing sleep health as a core component for perimenopause and menopausal women. Wide-ranging impact of sleep disturbances in perimenopause and menopausal women. So quality of life. Sleep disturbances significantly impair daily functioning. Women often report feeling exhausted, having difficulty concentrating, and struggling to complete tasks. This can affect both personal and professional life, leading to decreased productivity and satisfaction. Poor sleep exacerbates emotional challenges during perimenopause and menopause. Women frequently experience increased irritability, mood swings, and reduced ability to cope with stress, which can strain relationships and overall mental well being. Then, mental health. There is a strong link between sleep disturbances and mental health conditions such as depression and anxiety. Hormonal fluctuations combined with chronic sleep deprivation can lead to heightened feelings of sadness, hopelessness, and anxiety. Lack of quality sleep can impair cognitive functions, including memory, attention, and decision making. This cognitive decline can make it difficult to manage everyday responsibilities and can contribute to a sense of overwhelm. Then, physical health. Chronic sleep disturbances are associated with an increased risk of developing serious health conditions such as cardiovascular disease, hypertension, and diabetes. The lack of restorative sleep disrupts the body's ability to repair and maintain itself, leading to long term health issues. Sleep deprivation can lead to weight gain due to hormonal changes that affect appetite, regulation, and metabolism. This can further increase the risk of metabolic disorders such as insulin resistance and obesity. If you've ever had a night of less sleep than normal and then the next day notice that you're craving sugar, that's why. Link between poor sleep and other health issues. Poor sleep can worsen other menopausal symptoms such as hot flashes, night sweats, and mood disturbances. And around we go. This creates a vicious cycle where these symptoms further disrupt sleep, leading to more severe issues. Chronic sleep deprivation weakens the immune system, making women more susceptible to infections and slower to recover from illnesses. This can compound the physical toll that menopause already takes on the body. The impact of sleep disturbances on perimenopausal and menopausal women is profound and multifaceted. Poor sleep affects every aspect of life: physical, mental, and emotional, leading to a cascade of health issues that can significantly diminish quality of life. Addressing sleep disturbances is essential, not just for improving rest, but for safeguarding overall health and well being during these critical stages of life. What's behind sleep changes in perimenopause and menopause? First, we have hormonal fluctuations. Estrogen plays a crucial role in regulating sleep. As estrogen levels decline during perimenopause and menopause, it can disrupt the sleep wake cycle, leading to difficulties in both falling and staying asleep. Estrogen also helps to regulate body temperature, and its decline can trigger hot flashes and night sweats, further disturbing sleep. Known for its calming effects, progesterone helps promote sleep by reducing anxiety and helping the body to relax. A decrease in progesterone levels during perimenopause can lead to increased anxiety and restlessness, making it harder to achieve deep restorative sleep. Hot flashes and night sweats. Hot flashes are sudden feelings of warmth that are often accompanied by sweating, flushing, and an increased heart rate. These can occur during the day or night, but nighttime hot flashes, often referred to as night sweats, are particularly disruptive to sleep. The sudden increase in body temperature causes women to wake up frequently, often drenched in sweat, making it difficult to fall back asleep. Night sweats are a direct result of the body's attempt to cool down after a hot flash. These episodes can be so intense that women need to change their clothing or bed sheets, further interrupting sleep and leading to a cycle of poor rest. Anxiety and stress. Hormonal fluctuations can lead to heightened anxiety during perimenopause and menopause. This increased anxiety can manifest as racing thoughts, difficulty relaxing, and an inability to shut off the mind at night, all of which contribute to insomnia. The stress response is often heightened during perimenopause due to hormonal changes. This can make it more difficult to manage daily stressors, which in turn affects the ability to unwind and fall asleep at night. Chronic stress can also lead to a vicious cycle where poor sleep exacerbates stress and increased stress further disrupts sleep. Other contributing factors. Mood swings are common during perimenopause and menopause and can be both a cause and an effect of sleep disturbances. Emotional instability makes it harder to fall asleep, while lack of sleep can worsen mood swings. Physical changes such as joint pain, headaches, and other aches are more common during menopause and can disrupt sleep. These discomforts, combined with the hormonal shifts, can make it difficult to achieve restful sleep. The sleep disturbances experienced during perimenopause and menopause are largely driven by hormonal changes, particularly the decline in estrogen and progesterone. These changes not only disrupt the sleep wake cycle, but also contribute to hot flashes, night sweats, anxiety, and stress, all of which make it harder to get a good night's sleep. Understanding these underlying causes is the first step in finding effective solutions to improve sleep quality during this challenging time. Clinical guidelines for managing sleep disturbances in perimenopause and menopause. Overall, talk first about hormone replacement therapy or HRT. We have estrogen therapy alone. Estrogen replacement is often recommended for women experiencing severe sleep disturbances due to hot flashes and night sweats. HRT can help stabilize hormone levels, reducing these symptoms and improving sleep quality. We can add progesterone therapy to that. For women who cannot take estrogen or prefer not to, progesterone alone may be prescribed to help with sleep, particularly due to its calming effects. So, if anxiety is one of the things that is disturbing sleep, progesterone could help. Cognitive behavioral therapy for insomnia. So, what it is, CBT is a structured program that helps women address the thoughts and behaviors that prevent them from sleeping well. It is considered the first line treatment for chronic insomnia and has been shown to be effective in menopausal women. CBT focuses on improving sleep habits and behaviors, managing anxiety around sleep, and creating a sleep conducive environment. There are many pharmacological treatments as well. Short-term use of sleep aids like benzodiazepines or non-benzodiazepine hypnotics may be considered in severe cases. These medications should be used cautiously and under close medical supervision. There's also non-hormonal options. Medications like gabapentin, which are not primarily sleep aids but help with hot flashes, may be prescribed to improve sleep indirectly. Lifestyle and behavioral changes, like sleep hygiene, which encourages practices such as maintaining a regular sleep schedule, creating a relaxing bedtime routine, keeping the bedroom cool and dark, and avoiding stimulants like caffeine and electronics before bed. Stress management, techniques such as mindfulness, meditation, and relaxation exercises can help reduce stress and anxiety, making it easier to fall asleep. I personally do guided meditation every night. Helps so much. Diet and exercise, balanced diet. A diet rich in magnesium, calcium, and omega-3 fatty acids can support better sleep. Women are also advised to avoid heavy meals, caffeine, and alcohol close to bedtime. Little pearl, alcohol actually decreases your melatonin, which you need to fall asleep. Regular physical activity. Exercise is beneficial for overall health and can promote better sleep. However, it's important to avoid vigorous exercise close to bedtime. It can actually have an awakening effect. The importance of individualized treatment. Each woman's experience with perimenopause and menopause is unique, and so are the underlying causes of her sleep disturbances. What works for one woman may not work for another. Therefore, it's crucial to tailor treatment plans to the individual, taking into account her specific symptoms, health history, and lifestyle. Sleep needs and challenges can change over time, especially as women progress through different stages of menopause. Regular follow-up and reassessment are key to ensuring that the treatment plan remains effective and is adjusted as needed. Combining different strategies, hormonal, behavioral, pharmacologic, and lifestyle-based, often yields the best results. A comprehensive, holistic approach ensures that all contributing factors to sleep disturbances are addressed. Clinical guidelines for managing sleep disturbances in perimenopausal and menopausal women emphasize the need for a multifaceted approach. By incorporating hormone therapy, cognitive behavioral therapy, lifestyle changes, and individualized care, women can find relief from sleep disturbances and improve their overall quality of life during these transitions. FDA approved treatments for sleep disturbances in menopause. HRT. Estrogen therapy is one of the most common FDA approved treatments for managing menopause related symptoms, including sleep disturbances caused by hot flashes and night sweats, which we talked about. Effectiveness. Estrogen replacement has been shown to significantly reduce the frequency and severity of hot flashes and night sweats, leading to improved sleep quality. Potential side effects can include an increased risk of blood clots, stroke, and certain types of cancer, such as breast cancer, which honestly, this is not as true as it used to be. The Women's Health Initiative that we thought was like the gold standard is not what we thought. There's some great data in there, but unfortunately, the way that it was interpreted and disseminated, especially without the full consensus of the team, it was done wrong, just flat out wrong. So the risk of these things is not as bad as we thought it was. And in fact, there's actually been some more evidence that it can actually improve your risk for breast cancer instead of worsening it. So stay tuned for more on that. The research continues to come out. So women with a history of these conditions may need to explore alternative treatments. Again, this is the importance of having a personalized plan with your whole healthcare team involved. Combined estrogen and progesterone therapy. For women with an intact uterus or even without a uterus, we still use progesterone because there are progesterone receptors throughout the whole body, including in the brain. Combined therapy with both estrogen and progesterone is recommended to prevent the risk of endometrial cancer, especially true if you do still have a uterus. We do not give estrogen by itself without progesterone for this very reason. Effectiveness. This combination can be highly effective in relieving menopausal symptoms, including sleep disturbances, while also providing protection against endometrial hyperplasia, which is overgrowth of those cells that can lead to cancer. Potential side effects. Similar to estrogen therapy alone, combined therapy carries some risks, including possibility of blood clots, heart disease, although again, there's also been shown studies that show actually protection against heart disease, and then breast cancer. But also again, we've also seen studies that show protection against breast cancer with HRT. So it's not clear cut and dry. It must be individualized. We must talk about your personal risk factors, your family history, all of the things. Low dose antidepressants, SSRIs and SNRIs. So selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are FDA approved for treating hot flashes, which can indirectly improve sleep. These medications, such as paroxetine, Paxil, and venlafaxine Effexor, can reduce the frequency and severity of hot flashes, leading to better sleep. Potential side effects. Common side effects include nausea, dizziness, dry mouth, and changes in appetite. These medications are generally well tolerated, but may take a few weeks to show full effectiveness. And we just did the talk on libido, and unfortunately, SSRIs are known to affect libido for many people. So that's something to be aware of. Then we have gabapentin, also known as Neurontin. Although originally approved for treating seizures, gabapentin is also FDA approved for treating hot flashes, particularly in women who cannot take hormone therapy. So it's a nice option that we do have. Gabapentin has been found to reduce the frequency and intensity of hot flashes, especially at night, which can improve sleep quality. Side effects may include dizziness, fatigue, and unsteadiness. Some women may experience swelling in the extremities or mood changes. We also have Lunesta. This is an FDA-approved medication specifically for the treatment of insomnia, which may be prescribed to menopausal women struggling with sleep disturbances. This medication helps with falling asleep faster and staying asleep longer, improving overall sleep quality. Side effects can include drowsiness, which is what we're going for, right? Dizziness, and a metallic taste in the mouth. Long-term use may lead to dependence, so it is usually prescribed for short-term use. While we're working on other underlying causes, could be an option for the person who is just desperate to get a good night's sleep. We have Ambien. This is another FDA-approved medication for treating insomnia, often used to help with sleep initiation in menopausal women. So those who have trouble getting to sleep, this could be a good option for them. It is effective in helping women fall asleep more quickly, though it may not be as effective for maintaining sleep through the night. So you still might end up waking up and you can't get back to sleep. Side effects can include dizziness, headache, and potential next day drowsiness. There is also a risk of dependence and unusual behaviors such as sleepwalking with long-term use. I do not like using Ambien for people who are like over the age of 65 or really over like the age of 85. It tends to have the opposite effect and will actually wake them up and make them like crazy. So it's not my favorite, but it is something that can be used to really help with, again, really, really severe sleep deprivation where we're desperate for something to help while we're working on other things. So FDA-approved treatments for sleep disturbances related to menopause offer various options from hormone replacement therapy to specific sleep medications. While these treatments can be highly effective, they come with potential side effects that need to be carefully considered. Individualized treatment plans based on a woman's health history and symptoms are essential to ensuring both effectiveness and safety in managing sleep disturbances during perimenopause and menopause. Off-label treatments for managing sleep disturbances in menopause. First up, we have melatonin. Melatonin is a hormone naturally produced by the pineal gland that regulates the sleep-wake cycle. Melatonin supplements are often used off-label and over the counter to help with sleep disturbances in menopausal women. Research suggests that melatonin can be beneficial for improving sleep onset and quality, particularly in women experiencing insomnia due to hormonal changes. A study published in the Journal of Sleep Research found that melatonin improves sleep efficacy in menopausal women. Melatonin is generally considered safe, but some women may experience side effects like daytime drowsiness, dizziness, and headaches. I've also heard some people say they had vivid dreams. Some of them are okay with those vivid dreams. Some of them do not like it, and it is a barrier to them actually using that medication or that herbal supplement, hormonal supplement. Gabapentin, low dose. While gabapentin is FDA approved for hot flashes, it is also used off-label in lower doses to help with sleep disturbances, particularly for reducing nighttime awakenings. Studies have shown that gabapentin can improve sleep quality by increasing deep sleep stages and reducing the frequency of nighttime awakenings. This is particularly beneficial for women who experience sleep disruptions due to hot flashes and night sweats. Common side effects include dizziness, fatigue, and unsteadiness. Low dose tends to minimize these side effects, though. Clonidine. Clonidine is a medication originally approved for treating high blood pressure, but it is used off-label to manage menopausal symptoms, including hot flashes and associated sleep disturbances. Clonidine has been shown to reduce the frequency and severity of hot flashes, which can lead to improved sleep. However, its effectiveness varies, and it is generally considered less effective than other treatments. Side effects can include dry mouth, constipation, drowsiness, and potential changes in blood pressure. Just one of the uses of it is to reduce the blood pressure. Makes sense. It is not commonly used as a first-line treatment, but may be considered when other options are unsuitable. Trazodone. It's an antidepressant that is frequently prescribed off-label for insomnia. I see it all the time, particularly in women experiencing sleep disturbances and menopause. Trazodone is known to help with sleep initiation and maintenance by promoting deeper sleep stages. Research indicates it can be effective in improving overall sleep quality without significant morning drowsiness. Side effects may include dizziness, dry mouth, and a potential risk of daytime drowsiness. Trazodone is generally well tolerated and is considered a safer alternative to other sedative medications. Pregabalin or Lyrica. Pregabalin, an anticonvulsant and anti-anxiety medication, is used off-label to help with sleep disturbances, particularly in cases where pain or anxiety contributes to insomnia. Pregabalin has been shown to improve sleep quality by reducing pain and anxiety, which are common issues for menopausal women. It can also increase the duration of deep sleep. Common side effects include dizziness, fatigue, which we're actually going for, and weight gain. Not so much. It is generally reserved for women who have not responded to other treatments. Acupuncture. This is a traditional Chinese medicine technique, and you can see that on the screen here, that is sometimes used off-label to manage sleep disturbances in menopausal women. Some studies suggest that acupuncture can help improve sleep quality and reduce the severity of hot flashes, which can contribute to better sleep. However, more research is needed to confirm its effectiveness. Acupuncture is generally considered safe when performed by a qualified practitioner. Side effects are minimal, but may include bruising or soreness at the needle sites. Off-label treatments for sleep disturbances and menopause provides additional options when FDA-approved treatments are not suitable or sufficient. Also can be used for those people who would rather not go down the road of using drugs if they don't have to. While these treatments are not specifically approved for this purpose, clinical evidence and patient experiences suggest they can be effective. As with any treatment, it is essential to consider potential side effects and tailor the approach to each woman's individual needs and health profile. Herbal remedies for managing sleep in disturbances during menopause and perimenopause. We have valerian root. It is a popular herbal remedy traditionally used to treat insomnia and anxiety. It is believed to work by increasing the levels of gamma aminobutyric acid, GABA, in the brain, which has a calming effect. Studies on valerian root have shown mixed results. Some research indicates it can help improve sleep quality and reduce the time it takes to fall asleep, especially when used over a few weeks. A review published in Sleep Medicine Reviews found valerian to be mildly effective in improving sleep quality. Valerian root is generally safe, but some women may experience headaches, dizziness, or gastrointestinal issues. It may also cause grogginess in the morning if taken in larger doses. Lavender. Lavender is an herb known for its calming and relaxing properties. It is often used in aromatherapy to promote better sleep and reduce anxiety. Some studies have shown that lavender, particularly in the form of essential oil, can improve sleep quality and duration. A study published in the Journal of Alternative and Complementary Medicine found that lavender oil inhalation improved sleep quality and in people with mild insomnia. Lavender is generally safe when used as directed. However, some individuals may experience skin irritation or allergic reactions when using lavender oil topically. Chamomile. This is a well-known herb used to treat insomnia and promote relaxation. It is often consumed as a tea before bedtime. Chamomile has mild sedative effects that can help improve sleep quality. A study in phytomedicine found that chamomile extract reduced symptoms of mild to moderate generalized anxiety disorder, which can also improve sleep. However, the evidence for chamomile's effectiveness in treating chronic insomnia is limited. Chamomile is usually safe for most people, but it can cause allergic reactions, particularly in those allergic to ragweed. It can also interact with blood-thinning medications. Must be aware of this. Passion flower. Passion flower is an herb traditionally used to treat anxiety and insomnia. It is believed to increase GABA levels in the brain, which helps promote relaxation. Some research suggests that passion flower may improve sleep, particularly in people with mild sleep disturbances. A study published in the Journal of Clinical Pharmacology and Therapeutics found that passion flower improved sleep quality when used in combinations with herbs like valerian root. Passion flower is generally considered safe, but can cause dizziness, confusion, and at high doses, sleepiness. But again, that's what we're going for. Ashwagandha. Ashwagandha is an adaptogenic herb known for its stress-reducing properties. It is used to support overall health and improve sleep by lowering stress and anxiety levels. Recent studies suggest that ashwagandha may improve sleep quality and reduce sleep-related insomnia. A study in Curis found that ashwagandha root extract improved sleep in people with insomnia by improving sleep onset latency and overall sleep quality. Ashwagandha is generally well tolerated but may cause gastrointestinal upset, headaches, and drowsiness in some people. Herbal treatments offer a natural approach to managing sleep disturbances during menopause, with varying degrees of evidence supporting their use. While many women find relief with these remedies, it's important to remember that effectiveness can vary, and herbal supplements can interact with medications or cause side effects. Consulting with a healthcare provider before starting any herbal treatment is essential to ensure safety and appropriateness for individual health needs. The role of diet in managing sleep disturbances. What we eat can have a significant impact on our sleep quality, particularly during perimenopause and menopause, when hormonal fluctuations can disrupt sleep patterns. A well balanced diet that includes specific nutrients can help promote better sleep, while certain foods and substances can exacerbate sleep disturbances. Magnesium rich foods. Magnesium is a mineral that plays a crucial role in relaxation and sleep. It helps regulate neurotransmitters that calm the nervous system, making it easier to fall and stay asleep. Foods rich in magnesium include leafy green vegetables like spinach and kale, nuts and seeds such as almonds and pumpkin seeds, legumes, whole grains, and dark chocolate. Increasing magnesium intake can help reduce insomnia and improve sleep quality, especially in menopausal women who may experience anxiety and muscle cramps. Tryptophan-rich foods. Tryptophan is an amino acid that the body uses to produce serotonin, a neurotransmitter that regulates sleep. Serotonin is then converted into melatonin, the hormone that controls the sleep-wake cycle. Foods high in tryptophan include turkey, chicken, eggs, cheese, nuts, seeds, and soy products. Consuming tryptophan-rich foods in the evening can promote relaxation and help initiate the sleep process. Think about Thanksgiving turkey dinner. Complex carbohydrates. Complex carbohydrates increase the availability of tryptophan in the brain, which can enhance serotonin production and improve sleep. Whole grains such as oatmeal, brown rice, and quinoa, sweet potatoes, and legumes are good sources of complex carbohydrates. Including these in your evening meal can help stabilize blood sugar levels and promote better sleep. Omega-3 fatty acids, particularly EPA and DHA, are important for brain health and may help regulate sleep by reducing inflammation and promoting serotonin production. Fatty fish such as salmon, mackerel, and sardines, flax seeds, chia seeds, and walnuts are rich in omega-3s. Omega-3s can help reduce the severity of sleep disturbances and improve overall sleep quality. Vitamin D. Vitamin D is involved in regulating the sleep-wake cycle and may influence the production of melatonin. Fatty fish, fortified dairy products, egg yolks, and exposure to sunlight are good sources of vitamin D, but many people still need a supplement on top of that, especially if you live up in the Pacific Northwest with the rest of us here. Adequate vitamin D levels are associated with better sleep quality. Menopausal women should ensure they are getting enough vitamin D to support bone health and sleep. We absolutely check vitamin D levels. This is something you're not going to necessarily notice symptoms from until it's too late. Let's talk about foods and substances to avoid. Number one, caffeine. Caffeine is a stimulant that can interfere with the ability to fall asleep and reduce the quality of sleep. It blocks adenosine, a chemical in the brain that promotes sleep and can stay in the system for several hours. Half-life is usually around 4 to 6 hours, but some people are slow metabolizers, and as we get older, we become slower in our metabolism of caffeine. Sources include coffee, tea, chocolate, certain sodas, and energy drinks. To improve sleep, it's best to limit caffeine intake, especially in the afternoon and evening. Try and stop by like 2 o'clock in the afternoon if you possibly can, or have decaf. Alcohol. While alcohol might help some people fall asleep faster, it disrupts the sleep cycle, leading to poor sleep quality and frequent awakenings during the night. Avoid alcohol close to bedtime to ensure more restorative sleep. Heavy or spicy meals. Eating large or spicy meals before bed can cause discomfort and indigestion, making it harder to fall asleep. Opt for lighter meals in the evening and avoid spicy foods at dinner to promote better sleep. Some people, doesn't bother them. You don't have to worry about that then. Diet plays a crucial role in managing sleep disturbances during perimenopause and menopause. Incorporating sleep promoting foods and nutrients into your daily diet while avoiding substances that can disrupt sleep can lead to better sleep quality and overall well being. For personalized dietary recommendations, consulting with a healthcare provider or nutritionist like myself is advised to ensure that your diet supports your sleep and overall health goals during this transitional phase. The role of exercise in improving sleep quality during menopause. Regular physical activity is one of the most effective non pharmacological treatments for improving sleep quality, particularly during perimenopause and menopause. Exercise helps regulate the body's circadian rhythm, reduces stress and anxiety, and promotes deeper, more restorative sleep. Beyond improving sleep, regular exercise also supports overall health by reducing the risk of chronic conditions, improving mood, and maintaining a healthy weight, factors that can indirectly enhance sleep quality. So, those types of recommended exercises include aerobic. Aerobic exercises, also known as cardio, include activities that increase your heart rate and improve cardiovascular health. Examples include walking, jogging, cycling, swimming, and dancing. Regular aerobic exercise has been shown to reduce the time it takes to fall asleep and increase the amount of deep sleep. It also helps to alleviate symptoms of anxiety and depression, which are common sleep disruptors during peri and postmenopause. Strength training. Strength training involves exercises that build muscle and strength. Weightlifting, bodybuilding exercises such as squats, lunges, push-ups, and resistant band workouts all count as strength training. Strength training not only improves physical strength, but also helps regulate hormones, including cortisol, which can improve sleep. Additionally, it helps with maintaining bone density and muscle mass, which are very important for overall health during peri and postmenopause. Yoga and stretching. Yoga combines physical postures, breathing exercises, and meditation to promote relaxation and flexibility. Examples include hatha yoga, restorative yoga, and gentle stretching routines. Yoga is particularly effective for reducing stress and anxiety, which can improve sleep quality. The practice of deep breathing and mindfulness in yoga also helps calm the nervous system, making it easier to fall and stay asleep. Mind-body exercises. Mind-body exercises emphasize the connection between the mind and the body, focusing on controlled movements and breathing. Examples include Tai Chi, Pilates, and Qigong. Also, yoga and weightlifting are included in these. These exercises improve relaxation, balance, and mental clarity. They are gentle on the body and can be particularly beneficial for women who are experiencing joint pain or stiffness, which can disrupt sleep. Timing of exercise. When is the best time to exercise? Trick question. Engaging in aerobic and strength training exercises in the morning or afternoon is ideal. Exercising during these times helps boost energy levels during the day and promotes better sleep at night by helping to regulate the body's internal clock. It is individualized, though, and it also depends on your underlying stress during your day, cortisol levels, all of these things. Morning or afternoon exercise can lead to better sleep by reducing stress levels and tiring the body in a healthy way, making it easier to fall asleep at night. Evening exercise. While some light stretching or yoga in the evening can be beneficial for relaxation, vigorous exercise close to bedtime can be counterproductive. Intense workouts in the evening can increase heart rate and adrenaline levels, making it harder to wind down and fall asleep. If you prefer to exercise in the evening, try to opt for low-impact calming activities like gentle yoga or a leisurely walk, or you do what you got to do because that's what fits in your schedule, and you come up with other ways of bringing down your the stress response after a workout. Regular exercise is a powerful tool for improving sleep quality during perimenopause and menopause. By incorporating a balanced routine of aerobic, stretch, and mind body exercises, women can not only enhance their sleep, but also improve their overall physical and mental health. Timing is key, with morning or afternoon exercise being most beneficial for promoting sleep. As always, it's important to choose activities that fit your individual fitness level and preferences to ensure consistency and long-term success. Lifestyle changes to enhance sleep during menopause. Addressing sleep disturbances during perimenopause and menopause often requires a holistic approach that includes lifestyle modifications. These changes can help create an environment conducive to better sleep and reduce the impact of stress, anxiety, and other factors that disrupt sleep. First, we have sleep hygiene. Sleep hygiene refers to habits and practices that are conducive to sleeping well on a regular basis. So we want to have a consistent sleep schedule. Go to bed and wake up at the same time every day, even on weekends. This helps regulate your body's internal clock. I know it sounds hard, but it's actually pretty important. Create a relaxing bedtime routine. Engage in calming activities before bed, such as reading, taking a warm bath, or practicing relaxation exercises. And then optimize your sleep environment. Ensure your bedroom is cool, dark, and quiet. Consider using blackout curtains, earplugs, or a white noise machine to block out disturbances. Limit screen time. Avoid screens, phones, tablets, computers, TV at least 1 hour before bed, as the blue light emitted can interfere with melatonin production and disrupt sleep. Sleep management techniques. Impact of stress on sleep. Chronic stress and anxiety are common during menopause and can significantly disrupt sleep. Managing stress effectively is crucial for improving sleep quality. Mindfulness meditation. Practicing mindfulness meditation can calm the mind and reduce anxiety, making it easier to fall asleep. Breathing exercises. Simple breathing exercises such as diaphragmatic breathing or the 4-7-8 technique can help reduce stress and promote relaxation before bed. If you want to hear a great example of some breathing techniques, go check out Betty McLean at Aim for Greatness Coaching, her very first podcast episode. She goes through an actual exercise of breathing routines. That's fantastic. I highly recommend you go check that out. Journaling. Write down worries or a to-do list before bed can help clear your mind and reduce nighttime rumination. Limit stimulants like caffeine and nicotine. Both are stimulants that can interfere with your ability to fall asleep and stay asleep. Mindful eating, reducing heavy or spicy meals. Talked about physical activity. We don't want to do vigorous physical activity before bed. Having a routine, winding down, creating a sleep environment that is conducive to sleep. So ideally, for a lot of people, we want to keep the temperature around 60 to 67 degrees Fahrenheit or 15 to 19 degrees Celsius. For some people, that's a little too chilly. But if you're underneath a comforter, usually we keep our bedroom at like 65, and that's like the sweet spot. I don't like my nose cold. So if my nose gets cold, it's too cold in there. Investing in your mattress and your pillows, super, super important. We spend, 8 to 9 hours ideally in bed every night. And it's really important. You can wake up with, neck pain, back pain, and all that kind of thing if you do not have good quality mattress, pillows, and things like that. So it's definitely an investment. Monitoring your sleep is also a really good idea. Keeping track of your sleep with a sleep diary. There's apps, there's watches, there's lots of different things out there. But so long as it doesn't increase your anxiety around sleep, though, because that can be counterproductive. So all of these lifestyle changes are really important to make sure that we are promoting healthy sleep patterns. And they're part of the holistic plan. So we don't just throw Ambien at it and call it good. We need to make sure that we're doing all of the things around it to promote healthy sleep. So let's wrap up our case study. We're almost done, guys. So finding relief, frustrated and exhausted, Jane reached out to Antigravity Wellness for support. During her initial consultation, we conducted a thorough assessment, including a detailed review of her symptoms, lifestyle, and hormonal changes. We came up with a personalized treatment plan. So, based on her assessment, Jane was provided with a personalized treatment plan that for her included hormone therapy to balance her estrogen levels, recommendations for improving sleep hygiene, and specific lifestyle changes such as stress management techniques and dietary adjustments. We put her on a full meal plan, took care of all of that for her. So she didn't even have to think about what she needed to eat. We gave her the meal plan, the recipes, and the shopping list. We're able to swap out meals as she needed and to adjust that to her family and her lifestyle. Came up with a routine for exercise that worked for her. She was actually able to start working out and start to stick to a routine, which she had struggled with before. So within a few months, Jane noticed significant improvements. Her night sweats became less frequent and she started sleeping through the night more consistently. Her energy levels and mood also improved, allowing her to reclaim her sense of well-being. Jane's case highlights the profound impact that sleep disturbances during perimenopause can have on daily life and the importance of seeking personalized care to find relief. Through targeted interventions, women like Jane can improve their sleep and overall quality of life during this challenging transition. Knowing when to seek help for sleep disturbances. If you've been experiencing sleep disturbances for more than a few weeks and they're affecting your daily life, causing fatigue, mood swings, or difficulty concentrating, it may be time to seek professional help. Chronic sleep disturbances can lead to more serious health issues such as anxiety, depression, cardiovascular problems, and a weakened immune system, including worsened perimenopause and menopause symptoms. If you notice these symptoms or if your sleep problems are worsening, professional guidance is essential. So there's some healthcare professionals that you can seek out. Number one, usually is your primary care physician. Your primary care physician can be the first point of contact for sleep-related concerns. They can evaluate your overall health, identify potential underlying causes, and provide initial treatment or refer you to a specialist. If your sleep issues are accompanied by other health concerns such as unexplained weight gain, severe mood swings, or persistent fatigue, a PCP can help address these in the context of your overall health. A functional nurse practitioner such as myself specializes in a holistic approach to health. We focus on identifying and treating the root causes of sleep disturbances, considering factors such as hormonal imbalances, lifestyle, and nutrition. So if you are seeking a personalized integrative approach to managing your sleep disturbances, an FNP such as myself can provide comprehensive care, including functional lab testing, hormone therapy, and tailored lifestyle interventions, meal planning, fitness, all of the things. Really helps to bridge that gap between primary care and where you want to be. Sleep specialist. A sleep specialist is a healthcare provider who focuses exclusively on sleep disorders. They can conduct sleep studies, diagnose specific conditions like sleep apnea, and recommend specialized treatments. If you suspect you have a sleep disorder, such as sleep apnea or restless leg syndrome, so if you're over the age of 40, honestly, we should be evaluating you for sleep apnea, or if standard treatments haven't worked, a sleep specialist can offer advanced diagnostic tools and treatment options. An endocrinologist. An endocrinologist specializes in hormone-related conditions, which are often at the root of sleep disturbances in perimenopausal and menopausal women. They can provide expert advice on managing hormonal imbalances. If hormonal changes are suspected to be the primary causes of your sleep issues, or if you need specialized management of conditions like thyroid disorders, an endocrinologist can offer targeted treatment. Mental health professionals. A psychologist or psychiatrist can help manage sleep disturbances linked to mental health conditions such as anxiety, depression, chronic stress, PTSD, things like that. They can provide therapies like cognitive behavioral therapy for insomnia or prescribe medications if necessary. If your sleep issues are closely tied to emotional or psychological stress, or if you've noticed an increase in anxiety or depression, seeking help from a mental health professional can be crucial. Knowing when to seek help for sleep disturbances is essential for preventing more serious health issues and improving your quality of life. Whether it's through your primary care physician, a functional nurse practitioner, or a sleep specialist, reaching out to the right healthcare professional can provide you with the support and treatment you need to regain restful, restorative sleep. At Antigravity Wellness, we're here to help guide you on your journey to better sleep and overall well-being. So there were some questions that came through, and I put these in the Facebook group. So if you're interested in being a part of that, where we do a little bit more interaction with our community, you can take a look at the description and apply. And even if you're a male and you're watching this, men and women, everyone, whether you're going through the perimenopause or menopause yourself, or you know someone who is, this can be very beneficial information to just educate yourself and be able to support that person even further. So all are welcome to apply. So the question was, why am I waking up in the middle of the night and why can't I fall back asleep? Many women experience frequent awakenings during the night due to hormonal fluctuations, particularly a decline in estrogen and progesterone. And these can lead to night sweats, hot flashes, and increased anxiety. These symptoms often make it difficult to fall back asleep. So, again, going to a tailored approach, finding out why you are having difficulty going back to sleep, why you're waking up in the middle of the night. Are you having racing thoughts? Are you having hot flashes? Do you have anything going on in your labs or your nutrition that is contributing to these things? That's why you need to talk with your healthcare team to come up with a plan and figure out how to best address your particular issues, because it's not going to be like anybody else's. How can I tell if my sleep problems are related to menopause or something else? It can be challenging to distinguish between sleep disturbances caused by menopause and those due to other factors like stress, lifestyle, or medical conditions. But don't ever let anyone tell you that you're just stressed out and you just need to be over it. Especially if you're in this range of perimenopause to menopause, we need to look at everything before we just say this is what it is. Okay. Monitoring your symptoms, including any related to hormonal changes, and consulting with a healthcare provider, your entire team, can help determine the root cause. Keeping track of your sleep cycle, taking that journal out and going, okay, so here I am. And if you're still cycling woman, you're still having periods, when am I having difficulty with my sleep? I had one client in particular who she was like, man, it's like once a month I have like a couple nights where I just wake up in the middle of the night. I can't get back to sleep. I'm just like, okay, so do me a favor and write that down and tell me where you're at in your menstrual cycle. And once she started tracking it, and even before she had a full month down, she realized it was around when she ovulated. And it was pretty consistent. And then some months wouldn't she'd be fine, and some months she wouldn't be fine, and she'd have issues. So, and okay, well then what's going on during those months? Is your diet off? Is your stress level high? What else is happening? Because especially if it's not consistent, it's not happening every single time, then it's less the hormones themselves and it's more of environmental factors that are contributing to that. But keeping track of the symptoms in correlation with your cycle is very important, because that really helps to give us some really good information about what is going on. And then we can come up with a treatment plan for that. So this is the last question. What natural remedies or lifestyle changes can I try before considering medication? A lot of people, especially that come to me, that's what they're most interested in. They're trying to either avoid medication, they're trying to get off of medication, because I do take a more holistic approach and go after everything. We use medication if we need it, and it is there, and it's a great tool to use, but it's just one tool in the toolbox. There's so many other things. So many women prefer to explore natural or lifestyle-based approaches to improve sleep before resorting to medication. Common remedies include improving the sleep hygiene, which is baseline, managing stress through relaxation techniques, adjusting diet, and incorporating regular exercise. So, consulting with someone like me who does functional medicine can provide personalized recommendations and really help to work with your healthcare team to come up with a plan that'll work best for you. All right, you made it. You made it to the end. All right. So, for you, I have a free Tranquil Sleep guide. So it just condenses this whole thing into a simple guide for you and has great recommendations in there to help you get your best sleep. So if you comment sleep or send me a DM, or if you are watching or listening to the podcast, it'll be in the show notes. You get the link there. And then if you are a perimenopausal woman who wants to know more about the services offered at Antigravity Wellness, I would love to talk with you. So you can schedule a free discovery call to talk to me and see how I can help. The link is in the description. All right. Thank you so much for joining me. If you were here to the end, you are a rock star. You want to know more about sleep and perimenopause. Thank you so much for your time and attention. And I love to hear from you all. So if there are ever any questions that come up, anything you want to know more about for perimenopause and menopausal women, let me know. Comment, send me a question in the DMs, get into that Facebook group so we can help support you even better. All right. Thanks so much. Have a great night. Bye.